So the answer to this question would have been C, broken skin which is bleeding. Redness, itching and inflammation are all sort of normal reactions to an allergic skin condition. Our next topic is psoriasis, which is a relapsing inflammatory disorder. So you get times of when the skin is okay, and then other times when you have a flare-up and lesions present. It can present at any time in life, although it's rare in infants and uncommon in children. It tends to affect those sites of skin where there's been some trauma, maybe sunburn areas, around cuts, and it's quite common during periods of stress. It can affect various parts of the body. The most common are the scalp, knees and elbows, and it tends to occur in a symmetrical distribution. So this is of some examples of the lesions and what they look like. Characteristically, they're sort of salmon pink lesions with thick white silvery scales with well-defined boundaries. The lesions, or plaques as we call them, are normally raised and they can be quite large. You need to refer if the lesions are extensive or if you're worried about any infection. The plaques on the scalp can lead to hair loss, and those red flag symptoms, so any non-blanching rash, bleeding, and if the lesions are accompanied with malaise, fever or swollen glands. Pharmacists are frontline healthcare professionals, and many patients will present with new skin conditions. We're quite best placed at the heart of the community and to help treat and signpost patients to appropriate healthcare professionals. So with psoriasis, that's one of those conditions that we can be involved in the diagnosis, but we need to refer them. The treatments are often quite potent and they will need to be initiated by a doctor or dermatologist, and the patients will need to be investigated further. First line treatment is emollients to help moisturise that dry skin. Coal tar preparations are available. Many studies have shown that they are effective, but they can be quite messy and they can stain the skin and they can stain clothing. Keratolytics, things like urea and salicylic acid, there's no real evidence to show that they are effective, but clinical practice suggests that we should use these. They can sting, but they do help to clear the scaling. Some practical tips and additional advice we can give. Keep going with the treatment. So even when they're having good periods of time, when there's no flare-ups, the treatment should be continued to help prevent those flare-ups happening. They'll need regular reviews with the dermatology team, assessing their condition and also their treatment. Maintaining healthy eating and exercise helps, particularly with the stress, which can help improve the psoriasis. There's slightly higher risk of patients who have a diabetes and cardiovascular disease, although it's not really known why. Chickenpox is a childhood illness, although adults can get it too, and it's caused by a virus, the varicella zoster virus. It's very contagious, so if you have it, then you should not go to work, school, to help reduce the spread. Having said that, when young children do get chickenpox, you may have heard of things like chickenpox parties, where other parents or carers will want to introduce the child to somebody who has got chickenpox. Normally when they're quite young, in the hope that they'll get it before they start school. And generally, when the older you get, when you have chickenpox, the more severe complications you can have, and that's why people tend to do that. But now with obviously all the social restrictions that we have, that's not possible. It tends to start to get little spots, which starts on the trunk and moves out, mostly on the face, the ears, the scalp. It can get them under the arms and on the chest and the belly. After about 5 days, they form a scab, and it normally lasts about 14 days. The spots tend to be itchy. You might only just have a few spots, but some people can be affected and the spots cover their whole body, even inside their mouth, which can be quite painful. There can be fever. Most spots start on the trunk and then tend to move out, and an aching body. You need to refer if you're worried about any of the blisters being infected, so any bleeding or pus present. Anyone who's pregnant has a slightly higher risk of developing pneumonia, and there's also risk to the baby. You might have some patients who are on medication to weaken their immune system, so such as chemotherapy for cancer or medication for rheumatoid arthritis, or if somebody's had an organ transplant. Those patients are at greater risk of complications and more severe disease, so must be referred. Any treatment we have available over the counter will help with symptom relief. Paracetamol can be used for any pain or fever, and if there's itching, then we could either use antihistamines, emollients, or cooling gels. Chlorphenamine is an antihistamine available over the counter, although it can cause drowsiness, and that will help with the itching. The dose will depend on the age of the child. You'll be able to find all the information on the packaging. You won't be expected to know the dose of every product, but as long as you know where to find out the information, then that's okay. Check, even if it's a child, whether they would prefer tablets or liquid, and don't just assume that all children would prefer a liquid. Cooling gels help the sort of skin to feel a bit more better and reduce that itching and just generally make the child feel a little bit better. Some additional advice or non-pharmacological advice we can give. Drink plenty of fluids to help prevent dehydration, especially if there's fever. Loose fitting clothing and cotton fabrics are best because this can help stop the skin from becoming sore and irritated. And the big thing is stop the virus from spreading. So anything that the child might be playing with or anything that they touch needs to be wiped down or sterilised to try and prevent spreading between the family, and also frequent washing of bedding and clothing. Shingles is an infection caused by the same virus as chickenpox, and it affects the nerves in the skin, so it can be quite painful. It normally lasts about 2 to 4 weeks, and it tends to affect one side of the body, as in it's unilateral. Common presenting features, so you'll get fever, malaise, and a red sort of blotchy blistering rash. There's presence of nerve pain. This is like a burning, stabbing, shooting pain. Sometimes feels a bit like electric shocks. The skin can be more sensitive to pain than usual, so something that would not normally hurt, like a light touch or a cool breeze, will cause or feel like pain. All patients will need to be referred. So if there's any antiviral treatment needed or pain relief for the nerve pain, this will only be available. This is only available on prescription, and so the patient will need to go and see their GP. You can give some painkillers and antihistamines over the counter to help with the symptoms, but then you risk the patient not going to the GP, and really they should be going to visit them. Treatment that is available over the counter, analgesics to help with the pain, so paracetamol or non-steroidal anti-inflammatories if they're not contraindicated, and that can also help with the fever as well. With the rash, try to keep it clean to prevent getting it infected, again wearing loose clothing. You can also try using a non-adherent dressing, and this helps with both with the pain and helps to reduce passing on the virus. As with chickenpox, similar additional advice really: keep hydrated, particularly if there's fever, to prevent dehydration, wearing those loose fitting clothing, preferably cotton, to stop the skin becoming sore and irritated, and generally trying to stop the risk of the virus spreading. Our next condition is ringworm, which is caused by a fungal infection. And as you can see, you get these round lesions. The centre tends to be clear, and then you get a ring around the edge. Those lesions can be red and itchy. They tend to be raised, and you have this central area which is resistant to colonisation, so it looks clear, is what we call central clearing. And then you have the defined border around the edge. So it looks a bit like a polo mint. There might be single or multiple lesions, and some of them can overlap. Our referral criteria: if large areas of the body are affected, if they tried a treatment that's failed, or if there's any facial or scalp or anal genital involvement, anyone who's pregnant or breastfeeding, or any red flag symptoms. We can treat it with an antifungal. So Canesten or clotrimazole 1% cream is available over the counter, and that's to be used 2 to 3 times a day for up to 2 weeks. It's only licensed for those aged 10 years and above. You shouldn't confuse it with the Canesten 2% cream, which is available over the counter for the use of thrush. Those practical tips we can give: avoid sharing personal items such as hairbrushes or towels, clothing, and then this will help to reduce the risk of the infection spreading. Try to avoid scratching areas of the skin or scalp that are infected to stop it spreading to other parts of the body. Bed linen should be washed on a hot cycle, and for anyone infected, their linen should be washed separately to anybody else's. This is an example of a short answer question that you could have in an exam. So a 30-year-old man presents with ringworm into your pharmacy, but due to heavy workload feels he won't have any time to treatment. List 5 non-pharmacological things that you could recommend. So thinking about the slide we've just gone through, you could mention 5 different things from there, and that would gain you your 5 marks. Now I have a patient scenario for you. So this lady comes into your pharmacy and she shows you a rash that she has on her arm. She says she was painting with her daughter Molly when the rash appeared. So you can see a picture of her rash here. She said her skin feels itchy, sore and bumpy and is quite red and angry. Have a little think about what more information you might want to ask Sarah, and think about any treatment recommendations that you might make, and then we'll go through it on the next slide, the next screencast, sorry.